Just for people who like me who come in for the first time, could I show them your booth and what it looks like?
Please,
So there's
please.
take that away from them.
Please, absolutely. So what we have here is just a small enclosure. There is a window over here for patients that might be a little apprehensive of getting into a smaller environment. So the door does not lock, obviously, and then we use various things. We have some insert earphones that we use. We also have a bone conduction device right here that goes behind the ear on what's called the mastoid bone. So we have that capabilities. We also have different capabilities for kids to test some of the younger kids that we see in our office as well. Some of the other additional equipment we have back here, we assess the middle ear function, making sure, like I said, there's no fluid, make sure there's no hole, anything like that that could be causing a problem with the ear itself. As audiologists, we get a lot of referrals from primary care physicians as well as from ear, nose, and throat doctors. One of my main jobs also is to make sure that a patient doesn't have any significant dizziness or balance disturbances, because a lot of people don't realize your inner ear controls your hearing and your balance. So it's important to make sure that those two, if they do go hand in hand, that we can certainly treat them.
One of the things that I guess I was surprised about when I came here was when you sat me down in the chair across the room and we talked about the hearing aids. I looked up and I saw your computer screen. You're already taking all the information you got from the booth here, and it was on that computer, and you had a graph for me to see. I thought that was kind of interesting.
Yeah, and that is really important. So we'll download some of that information and we'll transform it over to the computer, and then we'll be able to show the patient visually exactly what their hearing loss looks like in perspective, or I guess give them a perspective of how that looks in terms of the speech sounds and everything that occur in everyday society. Obviously, when we start talking about different consonant sounds, like an S or an F, if somebody says the word else, does it sound like elf? If you say the word carve, does it sound like car instead of carve a turkey? Those are things that obviously people have difficulty with. And some people can hear, but they oftentimes have difficulty understanding. And that's one of the things that we want to look at.
Is it allowed for you to show some of my graph on the computer?
Sure, if you'd like, I'd be more than happy to.
Yeah, I think that would be a good visual for people.
Wonderful.
So could we do that?
Sure.
Okay.
So what we'll do here is we will take a look at the person's audiometric information that we have obtained from all the testing that we have done, and we're going to put this into the computer system, and then we're able to show a graphic here for the patient, and this is exactly what Mr. DeRousse's hearing loss looks like. So here is the right ear, which is in red. The left ear is in blue. This is the main speech range that we're looking at here. So we have sounds like an S and an F and a TH, Ks, Ts. So if his wife says, hey, we're going to go to the restaurant tonight with someone else, does it sound like we're going with someone elf or some other elf, or does it sound like someone else? So when his hearing is down here and his hearing loss is above that and some of these sounds are up here, he may have difficulty understanding those. So my job as an audiologist is to find the right and appropriate technology to make sure that he is now hearing all of these speech sounds. One of the things I always coach patients about is a lot of their latest research shows that dementia and Alzheimer's and social isolation start to take effect when you can't hear. One of the important things that we know is your brain is a muscle, and you've got to keep everything active and you keep it busy. And when you keep it active and keep it busy, research shows that there are some very positive long-term solutions and some positive things that can happen with that. So we take pride in our job as audiologists. We've gone to school for a minimum of 8.5 years in terms of college education. So we're not here to sell somebody just a product and say, call me if you have a problem. This is a very personal approach that I have with patients, and we want to make sure that each and every patient feels that they are part of our family in our practice and that we are here for them long term.
Well, you probably guessed it by now. I did indeed have some hearing loss. And that decision to go see Dr. Hopper was a long time in the making. Been thinking about it for maybe even a couple of years, but I just didn't want to admit that I had a problem like that. When I finally did, I found out that I had indeed the hearing loss that Dr. Hopper identified for you. As a result, I did get hearing aids, the in-ear hearing aids. Life is better. I hear better. I hear things that other people heard. I didn't know I heard. They were out there, but it was a good decision. I guess my advice to you is, if you feel like maybe there is a possible hearing loss, go have it checked out with an audiologist. Don't go down to the local hearing aid store and have them check it out for you. That's what they do. They sell hearing aids. With an audiologist, it is things that there's things there that they can check that perhaps a hearing aid store most likely won't. You might want to consider cost. Dr. Hopper offered a lot of different options for me. After speaking with him, and telling him what I was looking for, we came upon the one that I'm wearing now. So there is a cost to it. I'm not sure if necessarily insurance will take care of it all the way, but check out with it. If you think you have a hearing loss, go to a hearing specialist, an audiologist. Have a frank discussion with them. Let the audiologist know what your needs are, what you're looking for. Have him do, and based upon the results of the tests he give you, you can find things that certainly will improve your life. But don't take that decision lightly. When I decided to get my hearing checked, I thought maybe it'd be interesting to find out a little bit about hearing loss, the history of it, and a little bit about the history of the hearing aid. So how the technology has progressed from the beginning of time, we've always had hearing loss, to present. And if you want to find out a little bit more about that, I wrote it in my blog. And if you go to www.commonmanadventures.com and click on the blog section and type in hearing loss, you'll find out what I found out. So until we meet again, that's it.